Okay. So, our last topic sa Module 3 for tayo mag-exam sa Friday is wound care. Wound care is very easy. So, let's start. So, in our body systems, we studied about the skin, the layers of the skin. We have three layers of the skin. We have the epidermis, we have the dermis, and we have the subcutaneous tissue. So based on these layers of our skin, we should memorize it because we will know what stage of pressure ulcer our patient is having. Epidermis, dermis, and subcutaneous tissue. So before we'll proceed to the pressure ulcer or bed sore, let's take a look. What are those classification of wounds? So we can classify wounds according to severity or injury. So it can be superficial, mababaw lang, penetrating, or perforating. So what is the difference between penetrating and perforating? If we're saying about penetrating, okay, so ito yung second picture. Penetrating is pumasok lang siya pero hindi siya lumabas. So meron lang siyang entrance pero wala siyang exit. If we're talking about perforating, meron siyang entrance and meron din siyang exit. We can classify also the wound based on cleanliness. We can have clean to contaminated, and we have contaminated, and we have infected. We can classify wound also regarding descriptive qualities. We have laceration, we have incision, we have abrasion, we have contusion, and we have avulsion. So, ayan yung mga pictures ng mga classifications natin or depends on the description. So, we have the incision, we have the avulsion, we have the puncture, we have the abrasion, and we have the laceration. We have also complications of in wound healing. We have the hemorrhage. When we're talking about hemorrhage, it is a severe bleeding, massive severe bleeding. Okay, it can be infection because it is an open space that microorganisms can come in. So it will be complication of wound healing. Dehiscence. If we're talking about dehiscence, it is an opening of a wound. Okay, so this one, opening of a wound. And we're talking about evisceration, it is protrusion of an organ out of the wound. So may lumabas ng organ. So that is eviscerations. And we have fistulas. Fistulas is abnormal passage from an internal organ to the outside of the body or from one internal organ to another. So, ano ba yung mga factors na nakaka-affect sa wound healing? We have the age. Mas matanda ang tao, mas matagal ang wound healing. Nutritional status, pag undernourished ka, wala kang protein sa katawan or less protein ang katawan mo, mas matagal mag-heal yung wound mo. Obesity, mas matagal mag-heal ang wound ng mga obese patient. Bakit? Mas marami silang fats. So, mas makapal yung fat content nila. Pag mas makapal yung fat content nila, mas matagal mag-heal. Extent of the wound, gaano ba kagrabe yung wound? So, kung mas malalim yung wound, of course, mas matagal siyang mag-heal kaysa sa mas mababaw lang. Then, tissue oxygenation. If you're having problem with tissue oxygenation, like if you have diabetes, your wound is caused by diabetes. So, nangingitim na yung limbs mo, paa mo, or kamay mo. So, mas matagal siyang gumaling kasi hindi na maganda yung oxygenation ng tissue. If you're smoking also, it's very difficult to have or very matagal yung paggaling ng wound because of nicotine. Then, immune system or immune status, if you're having drop of your immune status or immune system, mababa yung immune system mo, mas matagal mag-heal yung wound. Chronic condition like diabetes, mas matagal mag-heal yung wound. Radiation, if you're exposed to radiation, matagal mag-heal yung wound. And stress on the wound. If you're putting pressure on the wound, of course, it will bleed more. So it will be factors on wound healing. So if we're talking about wound pressure ulcer or bed sores, okay, we will handle later on. We will handle patients with pressure ulcer. Pressure ulcer or bed sore, it can also call as pressure sore, decubitus ulcer or bed sore. It is a localized injury to the skin and other underlying tissue, usually over bony prominence, as a result of prolonged unrelieved pressure. Okay, if you're not turning your patient, okay, the patient keeps on flat position. Your patient is only side lying position. So, mas matagal siyang side lying or mas matagal siyang flat, mas nagkakaroon ng pressure. So, what will happen? Pressure ulcer will develop. So, ang mga bony prominence ng katawan natin, ito, heel, we have the inner knees, hip, lower back, elbow, shoulder, and back of the head and ears. So, kung ang patient mo laging nandyan sa posisyon na yan, pwede siyang magkaroon ng pressure ulcer. So, ano mga risk factors para magkaroon ka ng pressure ulcer? We have the impaired sensory perception. Hindi masyadong nararamdaman ng patient mo yung wala siyang impaired yung sensory perception niya. Hindi siya masyado nakakaramdam sa part na yun. So, hindi niya nararamdaman na nagkakaroon na ng pressure ulcer. Impaired mobility, hindi masyadong gumagalaw. Alteration in level of consciousness. Your patient is bedridden and unconscious. Hindi siya masyadong gumagalaw. Of course, mataas yung risk niya na magkaroon ng pressure ulcer. Shear and friction, and we have moisture. Okay? So, according to the layers of the skin, we can classify what stage or classification of pressure ulcer we have. So if we're talking about stage 1, okay, yellow is your epidermis. So the affectation of your stage 1 is only the epidermis. If we're talking about stage 2, the affectation is epidermis and your dermis. If we're talking about stage 3, it's from epidermis until your subcutaneous tissue. This is brown color. And then if we're talking about stage 4, it's from epidermis until the bone, muscles and bones. So it's very easy if we know what are the layers of the skin, we can know what stage of pressure ulcer our patient is having. So what are the interventions to prevent pressure ulcer? Protecting the skin from external mechanical forces, teaching the patient caregivers about preventions like turning our patient every 2 hours, pressure ulcer care, cleaning the pressure ulcer, dressing the pressure ulcer, controlling infection, providing care when surgical interventions is necessary. Usually, if you're having stage 4 pressure ulcer, they're having operation already. So they are calling the operation as debridement. So they are cleaning the wound, they are removing the dead cells. So the wound will be regenerating to its original form. So wound management, we are doing wound care to prevent and manage infection. We need to cleanse the wound. We need to remove non-viable tissue, manage exudate, and protect the wound, client education, and nutritional support. So dapat ang mga patient na may pressure ulcer, we need to increase the protein, high protein diet, and we need to increase the vitamin C. So it will heal easily. So first aid for wounds, if you're having wounds, okay, we should control the bleeding, cleanse it, application of topical growth factors, and then protection. So dressings, these are the sterile protective covering we're applying to a wound or incision. Then types of dressings, we have the gauze dressings, we have the wet to dry dressings, non-adherent dressings, self-adhesive transparent dressings, and we have the hydrocolloid and dressings. When we're doing dressing change, we need to give first patients analgesic because it's a painful procedure. So we need to give them uh, analgesic or painkillers 30 minutes before doing the procedure. Explain the steps of the procedure to your client. Gather all necessary supplies. Prepare a sterile field. So you should wear a sterile gloves in doing this. Then remove all dressing. Answer client's question and document care. In cleaning wound, guys, we can follow two ways. First is we can follow on the left side. Okay, so this is your wound. We can do as one, throw, two, throw, three, throw. Hindi dapat pabalik-balik yung cotton. Dapat isang stroke, tapon agad. Isang stroke, tapon, isang stroke, tapon, isang stroke, tapon, hanggang matapos. Then, pwede mo rin gawin tong vertical. Okay? We are considering the wound itself as the cleanest. So we should start from cleanest to dirtiest. So yung outside wound, yun yung pinaka marumi. So we will start here. 1, tapon. Isang stroke, tapon. 2. So this is alternate. 2, 3, tapon. 4, tapon. 5, tapon. So we will follow this in cleaning the wound. So we are also using bandages and binders. So we are using these to provide extra protection and therapeutic benefits by exerting pressure, immobilizing a body part, supporting a wound, securing a splint, and then securing a dressing. So we should always check the bandage every 4 hours. Why? Because checking bandage might cause circulatory deficit. So pwedeng mangitim yung mga nail beds mo. So we should always check the distal circulation. Okay? How we will check? We should press our nail beds. Okay? The normal capillary refill is 2 to 3 seconds. So the color of this one, okay, should go back within 2 to 3 seconds. If it's late, okay, more than 3 seconds, it means that you have problem with your circulation. So at least 4 hours we are checking the distal circulation. We should check the color, the temperature. If it's warm, it's okay. But if it's cold, there will be a problem. Pulses, we should check the pulses. We know where is our pulses in our hands and our feet. I already told you where is your pulse sites. Then presence of numbness. If there is numbness, medyo namamanhid na siya, so there will be a developing problem. So what are the principles of bandaging and binder application? So position in normal anatomical alignment, prevent friction, apply bandages securely to prevent. So how to do bandaging, I'll teach you in module 4. So ito yung mga bandages natin. So wound care checklist. So first, we need to review medical orders. Then we need to gather all the supplies. Hindi pwedeng naka-sterile gloves ka na, then may kulang ka palang gamit. Dapat ipunin mo lahat ng kailangan mo. Then hand hygiene and PPE. Identify the patient. Close your curtain for privacy. Assess the patient for possible need for non-pharmacological pain-reducing intervention. So as I've told you, you need to give patient a painkiller or analgesic before doing the procedure. 30 minutes before doing the procedure, you need to give them painkiller. Place a waste receptacle or bag convenient location. Okay, maglagay ka dyan kasi yung mga tatanggalin mong old dressing, kailangan mong ilagay doon. And then yung mga itatapon mo, mga ginamit mong gauze, mga ginamit mong mga cotton, itatapon mo doon. Then adjust the bed into comfortable position. Assist the patient to a comfortable position that provides easy access to the wound. Check the position of drains, tubes, or other adjuncts before removing the dressing. Carefully remove the soiled dressing if there is resistance. There is resistance kung mahirap siya, nakadikit siya sa or may mga namuong dugo, we can put normal saline para hindi masaktan si patient. Then after removing the dressing, note the presence of amount, type, color, and odor of any drainage. Assess mo yung wound pagka-remove mo ng dressing kung meron ba siyang mga infection, dugo ba siya ng dugo, ano bang amoy uh, ng wound. So maybe meron siyang infection. Then inspect the wound using sterile technique, prepare a sterile work. So later on, I'll show you a video na ipapakita ng uh, wound dressing. Then open a sterile cleaning solution depending on the amount of cleaning needed. The solution might be poured directly over a gauze, uh, sponges over a container for small cleaning jobs, and then put on sterile gloves. Then clean the wound. Once the wound is clean, dry it. If the drain is used location, clean the wound on the drain. So we should always clean the wound from cleanest to dirtiest. So from inner to outer. So let's watch how to clean the wound. While preparing the wound, so what are the things you're needing in wound care? So part 2, hindi ko siya kompleto. So, dito nagtatapos ang ating discussion sa wound care.